Greetings, 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 ladies and gentlemen. Greetings, greetings, and welcome to the NCLEX mechanics class. Today's class is one of my favorites. Remember, we don't only have classes, but then I must also give you tips here and there of how to answer the NCLEX questions. So today we'll be discussing about the delegation of the LPN and UAP, relating it to the ECGs. Remember, they have this favorite question where they put ECGs and then they are going to say delegate either an LPN or a UAP using these EKGs, and then they're gonna put different kinds of EKGs or ECGs, and here are they. Remember, I'm not very good in drawing, so I try my best. But then, just a quick recap. Remember that when you talk about your ECGs, right, you have three main waves where you have the P wave. Remember, I'll draw it here, it's fine. You have the P wave, I hope you are following, and then you have the Q, you have the RS wave, and then you have the T wave, right? And then they are going to give you different kinds of the ECGs, like I stated, to say that delegate the UAP or LPN using the different kinds of ECGs, right? So this ECG number 1 and ECG number 2, ladies and gentlemen, these are the ones that you must select if you are delegating an LPN or a UAP. You must select these ones. Why? Because these are normal sinus rhythm. I know that maybe you might be asking yourselves, these are normal sinus rhythms. How? What do you think is happening here? This is what we call artifacts, right? We're going to go back to this original one. We have 1, we have 2, we have 3. The artifacts, they usually happen maybe if you are changing your patient's position, you are suctioning your patient, there's some kind of movement, or maybe the ECG leads are not well strapped, isn't it? So what you're gonna get when your patient is moving, when you are suctioning, we are gonna get the gibberish. You cannot even explain. You cannot even say that it's a ventricular tachycardia or what's or not. But then, as soon as your patient is settled, and then it goes back to normal. So this is what you see here. It goes back to normal. This has happened because your patient was moving. We are going to delegate them this one because it's either they give you number 1 or number 2. The second one, you might be asking yourself with the second one, all right, what is happening here, right? It's a normal sinus rhythm, but check this out. Don't confuse it with a flat line, because remember that when we have a flat line, what is it telling you? It's telling you that this is a systole. There is no pulse. But in this case, we are not having any asystole. It's a nice big gap. It's a nice big gap because maybe one of the leads were simply disconnected. So guys, ECG number 1, normal sinus rhythm, you are going to select it. ECG number 2, normal sinus rhythm as well. They'll give you either or any of these 2 ECGs, and then you are going to select any of these 2 ECGs. Remember, the 2 of them, it's a normal sinus rhythm. We are saying that you are going to select the normal sinus rhythm. Why? Because you must remember that when it comes to your LPN and your UAP, you must always delegate them patients that are stable. And with these 2 ECGs, these 2 patients are stable. This is going to be the end of the presentation. I hope it helps somewhat, somehow. And please enjoy the rest of your day. And I think by now you have my numbers. If you require any extra tutoring, I think by now you know how to contact me. Please don't forget to subscribe. Please don't forget to like, and have a good day. Lovely.